my name is Dr. Olivia Moses, and welcome to Wellness Live. We are so happy you've joined us today. Now, if you're watching this live, it is February, and that's National Heart Health Month. So we have to talk about the heart, and I got my red on today. We are all ready for the celebration for heart health. Now, you might not know that heart disease is the #1 killer in the United States. So how this goes is that probably every one of you watching knows someone or has been touched by someone who has had issues with their heart. And that's why we have a special guest today. His name is Dr. Anthony Hilliard, and he is a cardiologist here in our International Heart Institute, and he is the director of our cath lab. Now, he is the perfect person to talk to you about heart health and ways you can prevent and keep that heart beating. So without further ado, I'd like to introduce you to Dr. Anthony Hilliard.
Thank you very much. It's great to be here tonight with everyone. I want to take you back to August 1814. You might ask, what's significant about 1814? Well, during 1814, the War of 1812 was ongoing. I'm curious to see if there's any history buffs out there. And I ask you, who was the first lady during the War of 1812? I don't have the opportunity to ask for a show of hands, but there's often one in the crowd who knows, and I'm sure there's one at home that knows here today. And that first lady was Dolly Madison. Why do I bring this up? Well, Dolly Madison is really the first lady as we think about first ladies today. She was a woman that spoke her mind, she had good ideas, and was a very valuable person within the White House. August 24, 1814, the British, under the leadership of General Ross, were rapidly approaching the White House, and eventually they burned it down. Before they left the White House, Dolly Madison and her staff, she instructed them that she needed 3 things to take from the White House. She said, the British can burn down the White House, but they can't take my silver, they can't take my portrait of George Washington, and they can't take my velvet crimson curtains. Dolly Madison was a Quaker, a woman with little means, and she had always wanted silk damask red curtains. And at the time, it was too expensive to have those in the White House, and so her curtains were made out of fine velvet. It is told, the story goes on, that for the remainder of her life, at any event of any significance, she proudly wore this red dress shown on the screen. It was a red dress made from the curtains that she took from the White House before the White House burned down. Why do I show this? Well, Women's Heart Month, or February is Heart Month, and we pay particular attention to women's heart disease. And women's heart disease nationally is recognized by the red dress symbol. And while the red dress symbol doesn't have its story rooted in the story of Dolly Madison, I actually think it's a perfect story to represent defiance from heart disease, defiance from succumbing to the #1 killer in the United States. And I think it's great for all people, men and women, to proudly wear the red dress, not just during the month of February, but during every month of the year. We're going to spend some time talking about what I'm biased, but what I think is the most impressive organ in the body, and that's the heart. And unlike other organs, the heart is a muscle. And in fact, it goes without saying, but I'm going to say it anyway, that the heart has to beat continuously. It has to contract continuously. Think for a moment. You go to the gym and you take some weights and you do some bicep exercises. You do 10 or 12 or 14 reps, and those muscles are tired, and you put the weights down and you take a break in between your sets. You do 3 sets or 5 sets or something like that. Well, think for a minute if the heart took a break. It probably wouldn't do so well. If it took a break for a minute, you'd be passed out on the floor. If it took a break for 5 seconds, you'd feel lightheaded and need to sit down. So unlike other muscles of the body, the heart never rests. And in fact, during this talk this evening, your heart will have beaten over 2,000 times. In fact, today, February 22, your heart will have beaten over 100,000 times. If you think back to all the events that you had in the year 2016, your heart beat 40 million times. And if you're lucky enough to live to the ripe old age of 80, and I hope all of you are, and beyond, it will beat over 3 billion times. That's impressive. Each day, that little heart, I want everybody to grab their fist, put it up in front of you, put it on the left side of your chest. Now rip it out and stare at it. That's the size of your heart, your fist. This little guy here beats that amount of blood every day, 1,900 gallons. It is an amazing organ, and I think you would all agree with me now. I'm going to go into a little anatomy for you so you have a take-home for today, hopefully several take-homes. The first take-home is that the heart has two sides. It's not a complex organ. There's a right side and a left side. The right side takes the blood that has been used by the body from the legs, from the tummy, from the brain, from the heart itself to do its natural vital functions, and takes it back to the lungs. Now I would like everybody to take a deep breath in with me. Right then and there, all that blood that just came back to the right side of the heart was in the lungs. You took a deep breath in. That air that has oxygen in it went back into the lungs, reoxygenated that same red blood cell, and since I've been talking about this, went to the left side of the heart. And during my explanation of what's gone on, that blood has now been ejected. That oxygenated red blood has been ejected to the brain, to the tummy, to the legs, and equally important to the heart itself. For this muscle to function continuously and to function well, we need to keep the arteries that feed this muscle clean. We don't want them to get plugged up. They're not big. Remember, the heart is the size of your fist. They're not big. Think of a Bic pen or a pencil. That's the size of your artery, about 3 millimeters, a good artery. So it doesn't take much for that artery to get clogged. So today we're going to discuss what happens when that artery doesn't stay clean. What can we do about it when that happens? Why might it happen? This concept of the vulnerable patient. And most importantly, how do we try and prevent it from happening? As Olivia said in her introduction, the heart and heart disease is the #1 killer of every single person and demographic in the United States. In fact, heart disease will kill more people each year than all cancers and lung disease combined. It's profound when you think about it. And amazingly, we can almost prevent it from happening universally. And we know what to do with it. We know how to do that. It's just tough to do. I'm going to share a study. I'm going to share a patient that's like many patients we see. Maybe similar to a friend that you know, or maybe be very similar to the story you personally have. It's a 56-year-old female. She's pretty healthy. She felt a little funny after eating, some nausea. She felt some heaviness in her chest. She's never had this before. She said, I don't know, I'm not feeling very good, but you know, I'm pretty healthy, I'm pretty young. There can't be anything too significant happening to me. So she decides to take some Tums and goes to bed. She wakes up, fortunately, she wakes up, still not feeling well. And at this point, she's developed a sense of impending doom. She calls her daughter, who brings her to the emergency room at 2 p.m. the following day. So the symptoms have been ongoing now for over 10 hours. We're not going to do a course study in EKGs, but this EKG is not an EKG you want. Why is that? We call it a tombstone EKG. And a tombstone EKG indicates that one of your 3 arteries is completely blocked, 100% blocked. So what we can do in that situation is take the patient directly to the heart catheterization laboratory. It would look very similar to this. The table set up, and in 2017, we have 2 approaches to how we get to your heart. We get to your heart either through the wrist or the leg. And what we can do, this is a normal artery, her right artery, right coronary artery was the artery that was blocked. It looks like a letter C when it's nice and opened. That's how hers looked. Just a little stump. Just a little stump. So you can see that there's not enough blood supply getting to the heart. Why did that happen? Well, there's a tear in the artery. A plaque that had formed in the artery broke apart. And when it broke apart, it actually bled. It bled into the plaque. And the artery, the body, sensed this as being a problem. And it does everything it can to prevent itself from bleeding. It feels like it got cut in the wrist. And it clots it off. And you get 100% blockage, and that's why the symptoms begin like that. You're feeling fine, and then you feel something, and that's that artery getting blocked. So the rest of the talk, I'm going to focus in part on this concept of the vulnerable patient. There are things that contribute to that plaque rupturing. And it's globally called the vulnerable patient. There's the vulnerable plaque, the vulnerable blood, and the vulnerable myocardium, or the heart muscle. But before we get into that, I want to make sure that there's no questions about what we've talked about this far, and I'll have Olivia come back up.
Well, excellent so far. I never knew that story of the red dress. It's very interesting. So we do have some questions coming in. So what role does inflammation play in heart health?
It's a great question. I'll talk about that some moving forward in the talk. But inflammation is really the nidus for the development of coronary artery disease. And there's a concept of the low inflammatory diet. There's a concept of chronic inflammation. So some inflammatory diseases, systemic diseases that people have, can contribute in large part to the development of coronary artery disease and plaque. So it's a huge role, probably the most important role.
Another question, this is actually I have a question. So this case study that you had here, she waited.
Yes.
And I think there's a lot of women, we have aches and pains all the time, and we kind of wait till they go away. So how do you know when it's time?
Yeah, and that's the hard part. That's unfortunately one of the most common things we hear is, I didn't know this was the heart attack.
Okay.
It wasn't what I thought it was. It wasn't an ache on the left side of my chest that went to my jaw and caused arm numbness. Generally speaking, the symptoms are going to be subtle and different for everyone, and that's the problem. But most people feel a sense of impending doom.
Okay.
So yeah, it could be predominant nausea or tummy pain if it's the right coronary artery. Can be heaviness in the chest. But most people say, there's just there's something not right here. And that's, to me, the most important thing. Because we all have soreness in the chest from time to time, or indigestion after we eat, right? Mm-hmm. And we don't want everyone to think they're having a heart attack. But the point is the sense of impending doom. And as I tell patients, if you come to the ER with concerns of chest pain, you're not going to wait 8 hours. You're going to come to the front of the line. And on that note, I'll take this opportunity to say that if you have those symptoms and you're concerned you're having a heart attack, don't drive yourself. Don't have a loved one drive you. That's what 911's for. We have the emergency medical response system in place for these sorts of critical diseases, and this is the time to use them.
Okay. So it's better to call than to not call, basically.
It's always better to call than to not call.
Okay. Another question we have here, is there a way to ascertain feeling the difference between an esophageal spasm and heart issues?
Yeah, it's a very good question. Usually the only way that's ascertained is because you've evaluated one and it was okay. So in other words, I would never feel comfortable telling a patient that they have esophageal spasm prior to evaluating their heart. So if someone comes in with chest pain and they have a negative heart workup, and there are some motility studies that can be done from the esophagus standpoint, but it would only be after the heart had been evaluated. In other words, if someone comes to the ER with chest discomfort, we're not going to say, well, that's esophageal spasm.
Okay.
We're going to say, well, we need to evaluate the heart, et cetera, and if it turns out to be negative, then we can consider something like that.
Okay. Another question I had was, if a person is thinking, well, I'm 25 years old and I'm feeling this way, this could not be the heart, what would you tell that person?
It could be.
So you're never out of danger, basically.
It could be.
Yeah, so take it seriously.
Take it
And,
seriously.
take it seriously.
If it's a symptom you haven't had before and you're feeling a sense that something's not right, you need to get it evaluated. Now, if you have that symptom again after it's been evaluated and you knew you had a negative workup before, fine. But if you've never had it before and it's not something that's settling right, yeah, heart disease can happen in very young people, particularly with people who have other chronic diseases. For instance, if you have lupus, or if you have diabetes, if you've had long-standing diabetes, or if you're obese, or you smoke, or you've been under severe stress, any of these things can accentuate the progression of coronary artery disease.
So basically, when your body talks, listen to it. But here, am I right? Okay.
Body talks.
Better listen.
Yes.
So here we go. We have one more question. Does inflammation contribute to a buildup of plaque?
These are really good questions. The answer is we think so.
Okay.
We think so. Certainly, diseases, diabetes, obesity, these sorts of chronic diseases which are a promoter of inflammation are associated with more plaque, these patients who have these disease processes. It's hard to tease out exactly what's the disease and what's the sort of collateral that comes with it, but we do think that certainly the more inflammation you have, the more likely you are to have plaque progression. We have nice data to show that treatment of inflammation does reduce cardiovascular events. So if you take that and say, well, that's the marker for plaque progression, it's possible. I think the more important question that we can more definitively answer is not, is there more plaque progression or not, but it comes back to this vulnerable plaque standpoint. Situations that are very heavily inflammatory make plaque unstable. Plaque in and of itself doesn't kill you. It's when that plaque breaks apart. And then the blood that's in the artery, not inside the plaque, now gets into the plaque. The body senses that it's bleeding, sends platelets and clotting factors there to clot it off. So the plaque itself isn't the problem per se, it's when the plaque ruptures. And we know that inflammation can lead to a higher likelihood of plaque rupture.
Got it. Well, we had a session for questions and we'll have another one. So if you have any questions during the second half, please type them in and Dr. Hilliard will be here to answer them.
So on to part two. So the good old Chesterfield cigarettes, Virginia Slims. I don't want to date myself, but I do remember the Virginia Slims ads in the magazines. Not as much of a problem as they used to be. This used to be the biggest risk factor for coronary artery disease, cigarette smoking. And obviously one of the more easy ones then to fix, because if you could stop smoking, which is difficult to do, but if you could, you would reduce your chances of dying by 50% in the first year. Unfortunately, this is now second. This is the problem. Inactivity/obesity. This is a worldwide, but importantly, national epidemic of historic proportions. The problem is we're not getting better. We, the United States, are already the most obese nation on the planet, and we're getting bigger. You might ask, why is that? Well, it's tougher to tease out than you might think. It's not all about the calories you eat every day. It's about the type of calories that you consume. So if you consume a diet that's rich in carbohydrates, processed foods, fat, low in protein, that is going to be a very high glycemic load meal or glycemic load day, and the body's going to convert that to fat. So this chart is very interesting. Regardless of if you're a man or a woman, over time, you can see here, these are decades, the last 30 years or so, there really hasn't been much of an uptick in the amount of calories we've consumed. If you go back to the 50s and 60s, it's actually almost identical. But the problem is, there wasn't much obesity back in the 50s and 60s. But now it's prevalent. And the reason for that, in large part, is because of the amount of carbohydrates we're eating in our diet. Think about the reduced fat, packages. Well, what does reduced fat mean? It doesn't mean reduced calories. It means reduced fat. So what do they supplant fat with? They supplant it with sugar. Problem is, sugar makes you feel full immediately, and then about an hour later you're starving. So then you end up actually eating more than if you would have had the fat, because fat is sustaining. There's a lot of reasons why our portion sizes may be bigger. So we don't maybe eat as many times throughout the day, but we eat a big meal. I have my meal at 2 o'clock in the afternoon. No, you should have 5 meals spread out throughout the day. But think about it. Thank you for your order. May I supersize it for 39 cents more? Widowmaker Burger. That's the title of this burger. I didn't put that in there. Widowmaker Burger. Onion rings, mayonnaise, hamburger patty, multiple pieces of cheese, bacon. They have some good fat, avocado, and tomatoes and lettuce, and then a bun of epic size. Yeah, I agree. That probably is a Widowmaker Burger or a Widower Maker Burger, but you can buy it. So I would argue obesity is not such a bargain. And in fact, I won't get into employment issues, but obesity is the cause of more loss of employment for employees, for an employer, than any other problem. If we were to spin your blood after having French fries or some other highly saturated fat meal, we'd spin your blood. The blood is down here. This is all the other junk. That's your grease. That's the oils. That's the butter. That's what's floating around in your blood. Remember, the arteries in your heart are the size, they're bigger than your pinky. They're the size of a pencil. So when you think about that, that's a lot of stuff circulating through those arteries, waiting to get plugged up. So I'm not discouraging you from eating these things, but I would like you to have some PTSD with this photo. I want you to think about that the next time you're ordering one of those things. You need to know your numbers. I hope everybody watching today, if you don't know your numbers, you know your numbers by the end of the week, because every primary care doctor that you have or cardiologist managing your care will have your numbers or should have your numbers. And if they don't have your numbers, you need to ask them to order them so you know your numbers. You need to know what your total cholesterol is. You need to know what your bad cholesterol is. The LDL is bad, you want that low. The HDL is your heavenly or good cholesterol, and you want that high. The HDL goes around the body and picks up the bad cholesterol and takes it to the liver. It's the scavenger. It's very, very, very important. You want your circulating fats to be low, and you want your inflammation, a marker of inflammation, CRP, to be low too. You need to know these numbers. You need to know what your blood pressure, I want everybody to know, who's watching today, to at least know what their blood pressure was at least one time this week. You need to know what your blood pressure is. You need to know what your waist circumference is. Measure at the hips to the belly button. Needs to be less than 35 inches for women, less than 40 for men. It should be better than that. But at those numbers, if you see a 35 and you're a woman, and if you see a 40 and you're a man, you're at much higher risk for the development of heart disease. You know what your fasting glucose, it should be way away from the 3 figures. It should be in the 80s. We pass you in the 90s, but it should be lower than that. Portion control. Portion control, not supersize. Portion control is important. This from 6 to noon, 6 to 12, that's not the cheese and the eggs and the steak. That's the fruit and vegetables, and largely vegetables. Then you get a quarter for the protein, and you get a quarter for grains. And we would like to see those whole grains. That is a very simple formula for treatment of obesity. If you would do that, obesity would not be a problem. It's very simple. Now, I would say that prediction is difficult, especially about the future. Now, I stole that from Yogi Berra, but it's true. However, I'm going to try in the next couple minutes before we end to tell you about foods that are going to prevent a heart attack. I use that in quotations, but it's really going to reduce your odds. Eat oats. Oats are full of soluble fiber. They go around and soak up all that nasty floating fats that I showed you in the picture of the test tube. Eat nuts. Nuts are good. They're healthy fat. Fat is not bad. Fat is good. Good types of fat. You want the unsaturated fats, the mono and polyunsaturated fats. Walnuts, almonds, pistachios, peanuts are great. They actually act like plant sterols, we call them, like actually cholesterol pills. Eat your lentils. Lentils can reduce your chances of having heart disease by over 80%. Eat your lentils. They're good for you. Garlic. Your bed partner might not like you, but your heart will be smiling. It's a dilator of the arteries. It helps slow plaque progression. Maybe why the Mediterranean diet has a lot of advantages. Eat your garlic. Fortunately, in Southern California, you can eat your oranges. It's not hard. Truly, the oranges have this fiber pectin that kind of act like a sponge, and they go around and soak up all the junk and take it back to the liver. Dark chocolate, 70%. Not milk chocolate, dark chocolate. Can work as an antioxidant and help lower blood pressure. You need to exercise. That's key. This is also how you prevent the heart attack. And the exercise is not the 30 minutes during the day that you ride the stationary bike. It's the other 23 and a half hours. We're good at doing exercise, but then we click the mouse the rest of the day. Don't do that. Exercise. In fact, you're 3 times less likely to die from cardiac arrest with moderate to high intensity exercise than if you do not. So exercise and then move around the rest of the day. It will save your life. So I say lace up your sneakers. If you do just one thing, move 30 minutes a day your way. A half hour of moderate intensity activity will help lower blood pressure, your triglycerides. It will raise that good cholesterol, that HDL, and cool inflammation. That's pretty cool. Your heart doesn't care if it's 30 minutes at once or 10 minutes 3 times during the day. You need to do some resistance training. It builds the furnace. It helps you burn more energy. So increased muscle mass burns more calories without even doing anything. Why do I show you this picture other than the fact that it's a tragedy in my opinion? I show you that because kids forget 70% of what you say and remember 90% of what you do. Think about that the next time you choose your food and choose your activities. And with that, I'll stop and open it up for more questions.
Okay, thank you. So let's talk we probably have a lot of viewers that are struggling with weight and struggling with diabetes or many other chronic diseases. And it can be a very scary place. And I think probably for a lot of these individuals, it's easy to kind of hide and say, I don't want to pay attention. What advice would you give that person?
I'm going to say it's difficult. To say that it's not is shortchanging you. You know, obesity is often the root of many problems. It can be, and so when I talk with patients about obesity, I preface it by saying there were probably lots of good reasons why you got to where you got. I mean, I don't know what happened in the past. It may have been the only way to cope in your situation. And I'm not dismissing any of that. I think that is critical. And in fact, I think successful weight loss programs, the reason why they're difficult is it usually requires that person to have that really sort of internal review of their life, because no one wants to be obese. And we got there somehow. And usually there is an emotional component to it. Not always. Sometimes there's a metabolic component, but often there is. So first thing I think for a successful sort of weight loss program is to really kind of dive down and do a reflection of yourself. And then it's to face the tough picture. And that's the picture of the self standing in the bathroom. I say that the scale doesn't, the scale is one thing, but a picture doesn't lie. And that's why, that waist measurement is a very powerful predictor of long-term outcomes, because the belly fat, not the hip and buttock fat, but that belly fat is really a driver of inflammation. It's like another organ. It's a risk factor for breast cancer, risk factor for diabetes, risk factor for coronary artery disease. So really knowing what your waist circumference is a very important first thing. And then I'd keep it simple. I like the portion control. Everybody has a plate. You know what to do with it. Don't make it more scientific than it needs to be. There is a philosophy in some religions that I think is useful too. It's called the 1/3 principle. So think of your stomach, this magic stomach of whatever size it is, and say I should have 1/3 of it full of food, 1/3 of it full of liquid, and 1/3 of it should be empty. And I think if you use those principles, that's certainly, in my mind, as about a foolproof way to go about the weight loss program or the obesity epidemic that we have. Clearly, there's a lot of fads, as recognized by you could pick one of 55 diets. If there was one diet that worked, there'd only be one, right? But I think keeping it very simple in my mind is useful. The last thing I'd say to that, I could talk for 3 hours about this, is you need to eat things that spoil, that expire. Processed packaged foods are filled with high fructose corn syrup, other sugars, other processing things. Your body doesn't know what to do with that. So I think the other rule of thumb when you're using your plate, if you will, is everything on your plate should expire, should be able to spoil.
No, that's great. And so for any of you who are actually in that category, who have weight, we can't fix it if we don't pay attention to it. So we do need to look at it, and there is help, and it can be fixed. So we are getting some really good questions here, a lot of scientific ones today. But you did mention stress, and a lot of people, they think of the mind differently than the body and say, oh, how could stress affect my heart? So can you talk a little bit about that? And because the question here is, how much of a role does cortisol play in heart health?
So
maybe explain what cortisol is.
So cortisol is produced from the adrenal gland. It's a steroid hormone. We can actually give it to individuals who have a deficiency in cortisol. I think you need the right amount. You don't want too much. You don't need too little. I think cortisol, in my mind, is not the issue. It's how does the cortisol get there? So clearly, anabolic steroids, other sort of steroids, we do know for a fact leads to increased risk of blood pressure, bad cholesterol deposition, and coronary artery disease. But I think cortisol in and of itself is not as much of an issue per se. I know where the question's going with the stress, stress release in cortisol surge. We don't have data to say that the stress with cortisol surge is what causes the problem. But we do know for a fact that high levels of stress over time, probably because of the associated increase in inflammation, does increase the risk of coronary artery disease. There's a separate diagnosis that I haven't even touched on today. It's called Takotsubo cardiomyopathy, which is described by the Japanese first, which is why it has this name. And the heart ends up looking like an octopus face. Another term that we now use in the literature is called stress-induced cardiomyopathy. So the heart gets acutely weak. It's like you're having a heart attack. The heart fails. We take them to the cath lab emergently. We do an angiogram, and their coronary arteries are normal. And invariably, universally, there's been some stressor. Sometimes it's a surgery or some sort of medical condition, but most often it's an emotional cause of severe stress that can lead to that. And there are certain patients that are more predisposed to that. Women certainly have a higher incidence of stress-induced cardiomyopathy. Classically described, initially a woman took her son to the airport as he had enlisted in the Army, and she remembered her father getting on the airplane and never returned. And that emotional sense was overwhelming, and she ended up with this stress-induced cardiomyopathy. So there is a clear correlation between stress, both in the acute setting, but when we're talking about plaque and plaque progression, inflammation associated with that high stress level is deleterious. And we see that in high-stress jobs for sure.
Okay. Wonderful to know that mind does affect the body. So we have to take care of all of it, right?
It's interconnected.
So we have one more question. It is there a net benefit from a well-balanced but low-calorie diet versus just a well-balanced diet alone?
I'm going to try to remove my bias.
Okay.
So my answer personally is yes.
Okay.
There is advantages. In fact, I think a monthly daily fast is good. So it resets the body. Removing my biases aside, I think the key is you need to consume, if you're overweight, you need to consume less calories than you need. It's a simple formula. And you can, the number of calories you need is variable. So we know as you age, you need less calories. We do know as you have more muscle mass, you need more calories. We also know if you exercise, you don't not only burn calories during that exercise period, but your body continues to burn them hours afterwards. So if you think about the total calories you need, that's influenced by exercise, muscle mass, age, and then obviously if you do those things, if you exercise and burn calories both during exercise and afterwards, and exercise with lifting weights and increasing your muscle mass, you could have more calories because your basal metabolic rate will be higher and you can have more. But I think the formula is simple. You got to have less than you need. And if you're calorie deficient in that regard. Now, there are some extreme diets like you use HCG and 500 calories and these sorts of things with a lot of water. Before you do those, I would encourage you to talk to your physician first to make sure that you don't have any health conditions that could cause that. But short of that, I think those diets are fraught with the inability to maintain. And this is the last thing I think is very critical. I hate the word diet. Diet implies an end. I've reached my goal and then I stop. That's why they don't work. So this is a lifestyle change. If you can't do what you're doing right now to lose weight forever, it's not going to work. So you can't feel like, okay, and if I reach my goal in 2.5 months, then I can do this. No, it's worthless. Why even waste your time? You got to be able to do what you're doing now and look at yourself in the mirror and say, I can do this forever. If you can't, you got to change what you're doing.
Well, that's a great note to end on. Lifestyle change, because it has to be sustainable. So I want to thank you so much for joining us, but I also want to tell you, if you loved this presentation as much as I did and want to hear more of Dr. Hilliard talk, we actually can have you watch on demand. Wellness Live is on demand, so you can actually hear another talk from Dr. Hilliard talking about heart health. Another thing I wanted to tell you, next month we're going to be live again, and we're going to be talking about everyday foods that fight cancer. And one of our cancer dietitians here at Loma Linda will be speaking. So thank you for joining us today, and we look forward to seeing you next month.